Amanda Varnes, a name known by many on Longwood University's campus, refuses to give up the fight with cystic fibrosis. Amanda has been dealing with cystic fibrosis since she was 1 year old. However, she does not remember growing up any differently than her peers.
It was kind of one of those things. I did treatments and nebs, and then I went to gymnastics or Girl Scouts. My parents raised me not really have it affect me, just to kind of keep on going with life.
When Amanda turned 8 years old, she cultured a rare fungus called trichosporon.
They were shocked, they scrambled to try to figure out how to treat it, what to look for. It took months in order for them to isolate it and figure it out. About her senior year of high school, it became pan-resistant, which means that we had no medication options for treatment.
Because this fungus is so rare, not many transplant centers would take Amanda's case.
And so we had to start early. Like John Hopkins turned us down. UNC Chapel Hill turned us down, and we applied to Duke because they were known to do more experimental things. They were, I guess, willing.
It wasn't long after finalizing arrangements with Duke when critical changes started happening in Amanda's life.
Like last week of school, actually, I got sick, and that was it. And I went home, and then I had this like coughing spell, and then I was like, I feel like I can't breathe. And then we went to my doctor back at home. Then I got sent to Duke. I flighted to Duke and got put on ECMO, which is heart-lung bypass, and I was trached.
We were to the point when she was transplanted on the 23rd of May, we were literally moments away from her not surviving. There were a couple of days prior to that we thought that they were going to remove her from the list because her kidneys had stopped functioning. All of her organs were shutting down, and they had told us to get prepared to make some tough decisions. We thought we were going to have to remove life support.
I personally think the biggest thing was the support from Longwood, and and also I think God, I definitely that was a big factor, just knowing that I was so blessed with just so much support and prayers from everyone.
And she had a few bumps in the road. Post-transplant, she had a really bad reaction to one of the anti-rejection medications, which caused a brain bleed. She had grand mal seizures, and she was unconscious for a little bit. But all in all, never lost faith. And she fought. Whatever they asked of her, she did without complaint. If they asked her to walk, she got up and walked.
Ahead of the curve when it comes to recovery, Amanda was able to graduate from rehab early. Normally, patients attend 23 sessions before graduating, but because of her determination, Amanda did hers in 20.
My goal was to be able to come back to school, and it only takes months for patients to be ready to go back to their jobs in school. And as a matter of fact, I had to change my major from elementary education to communications because when my doctor said that the mortality rate for educators is a lot higher than any other profession because you're dealing with kids and you don't have an immune system.
Because Amanda has to take so many immune suppressants, it would make it almost impossible for her to fight off little colds and illnesses that she would pick up being a teacher.
Of course I'm worried because you're essentially trading one disease for another. I might not have the hours of treatments I have to do, but I have medications and schedules and workouts and worrying about whether or not I can get sick or it's just that kind of thing. It's trading one thing for another, but I'm just happy to be alive and happy to be here.
The first day that when she and I pulled into the garage at our house, we just started crying because she's like, the last time I was in the garage, I couldn't breathe. She couldn't breathe at all.
The family is excited to see what Amanda's capable of that she hasn't been able to do for years. Doctors even couldn't believe how she'd been able to function so well as sick as she had been.
She has a very long routine of medications, but the trade-off is she's alive. So we feel like any day past the 21st of May has been a gift. We really thought we were going to lose her that day.
When asked what she would say to others going through similar situations, Amanda encouraged them to keep strong.
I just think the biggest thing is not giving up. Just believing in yourself. And I knew I had it. That I've got this. That was kind of my mantra throughout the whole thing was I've got this, and I knew I had it.